The following is a pictorial timeline on all measures taken by the government of the Virgin Islands to control, suppress, and prevent the spread of COVID-19 in the British Virgin Islands. On December 31, 2019, the World Health Organization China Country Office was informed of cases of an unknown pneumonia detected in Wuhan City, Hubei Province of China, later called novel coronavirus. On January 24, 2020, 846 cases of the novel coronavirus confirmed globally, affecting 8 countries across Asia, including China. 25 deaths were reported. Also on January 24th, the Ministry of Health and Social Development officials began to engage with local, regional, and international health agencies as a precautionary measure. 4 days later, on January 28th, the BVI activates quarantine authority to make provisions to prevent the introduction and spread of COVID-19. On January 31st, World Health Organization declares COVID-19 a public health emergency of international concern. On February 4th, the BVI issues Level 1 travel advisory urging residents to avoid non-essential travel to countries affected by COVID-19. On February 14th, the BVI Health Services Authority puts plans in place to manage COVID-19 threat locally. Also on February 14th, enhanced preventative and control measures reassured for cruise ship clearance protocols into the BVI. On February 24th, the BVI issues Level 2 travel advisory to enhance precautions to include Asian counties and Italy. The next day, on February 25th, BVI freight and cargo shipping companies engaged on precautionary measures in response to COVID-19. On February 28th, the BVI health officials notified of a returning national, which prompted testing. On March 4th, Health Emergency Operations Center was activated. On March 10th, the National Emergency Operations Center was activated at Level 1, prepare for the effective coordination of strategic responses across the territory. Also on March 10th, Premier and Minister of Finance, the Honorable Andrew A. Foy, signed the advance warrant and made funding available to better protect our frontline officers and the population, to purchase supplies and equipment, and to prepare the major People's Wing of the Dr. D. Orlando Smith Hospital as an isolation center. 2 days later, on March 12th, government met with supermarket operators, wholesalers, as well as local freight and cargo shipping companies to discuss precautionary measures in response to the coronavirus. The next day, on March 13th, a technical team called the Coronavirus Economic and Fiscal Stability Task Force was established to make recommendations and provide advice on the sustainability of the territory over a 6-month period. March 13th, Virgin Gorda Easter Festival and the 2020 Spring Regatta were postponed, and mass gatherings were under review by the National Emergency Operations Center. The next day, on March 14th, no cruise ships were allowed to call on the territory of the Virgin Islands for a 30-day period, and the number of international ports of entry in terms of passengers was limited to 3, namely the Terence B. Lettsome International Airport, Road Town Terminal, and the West End Ferry Terminal. March 14th, travel to the territory by visitors was suspended to non-nationals where the persons has traveled to, from, or through affected countries as defined by the World Health Organization in its list of special interest countries. March 14th, government met with the taxi operators, and visits restricted to Her Majesty's Prison, Adina Donovan Home for the Elderly, Rainbow Children's Home, Virgin Gorda Elderly Home, Safe Haven Transitional Center, and other private residential facilities. On March 18th, sanitization stations placed in all high-traffic government offices. The next day, on March 19th, all private and public schools, preschools, daycare centers, and extracurricular activities were closed. March 19th, all social gatherings, faith-based, sporting, cultural, recreational, and commercial activities, and other non-essential events were advised to restrict numbers to a limit of 30 persons at a time and a maximum of 10 people for those in vulnerable categories. And restaurants, bars, nightclubs, and other entertainment and hospitality services were asked to implement sanitization and social distancing measures within their establishments as advised by the Ministry of Health and Social Development. March 19th, Entry into the BVI was prohibited by air and sea to non-nationals, belongers, work permit holders, or persons ordinarily resident in the territory and their dependents. The travel restriction did not apply to flight crew, diplomats, or freight cargo or courier craft or vessels. And restricted numbers are permitted at government service-based offices. Also on March 19th, suspension of charges for water to water and sewage customers for a period of 30 days. A few days later, on March 22nd, all airports and seaports in the territory of the Virgin Islands closed to inbound passengers for 14 days. March 23rd, non-essential gatherings restricted to 20 persons. All businesses and services and all recreational facilities ordered to close by 8 o'clock p.m. and open at 6 o'clock a.m. with effect from March 22nd, 2020. On March 25th, the first 2 cases of COVID-19 confirmed in the British Virgin Islands, and a 24-hour curfew commencing Friday, March 27th at 8 o'clock p.m. until April 2nd at 6 o'clock a.m. was announced. 5 days later, on March 30th, the third imported case of COVID-19 confirmed in the British Virgin Islands. 143 persons were placed in self-quarantine. A few days later, on April 2nd, mandatory curfew extended from April 2nd to April 16th, and then to April 19th. 1 person from each household allowed access to essential services from 6 o'clock a.m. to 6 o'clock p.m. by surnames over a 3-day limited access period. Also on April 2nd, social distancing protocols mandated. No one under mandatory quarantine allowed to leave. Burials allowed with 20-person maximum during the 3-day limited access period. And waste management strategy began with house-to-house waste collection 3 days a week. On April 6, no new cases of COVID-19 reported in the BVI. 17 persons under investigation negative. 5 persons quarantined. No sign of community transmission. 3 positive cases being retested to determine full recovery. And Cabinet and Health Emergency Operations Center continues to work. Persons feeling sick? Call the medical hotline at 852-7650. Do your part and show BVI love. Stay home, stop the spread, save a life.